Mike McKnight, WOWT, apologies, the governor has already addressed this, but unfortunately I don't have the time to watch every news conference in detail. Really, Mike? This isn't like you just start scheduling your entire day around me? I'm a little disappointed. Anyway, so the venues, okay. The venue places, especially for weddings, are getting antsy. If the governor hasn't addressed this group of businesses yet, could you please ask him? The venue owners who are typically host wedding receptions are proposing options to reopen yet maintain safety guidelines. Have you read their ideas? Do you believe that they will work or should be venues? Certainly we're willing to take a look at some of those. I know I actually have received at least one letter in the office today with regard to venues. Again, what you can do is you can hold the wedding, but we are not opening up those receptions yet. So if you're looking to do the wedding reception, that is still not going to be possible, at least more than 10 people, but the wedding itself would be possible if you want to do that in a socially distanced way. And certainly, again, as we look to loosen restrictions down the road, that this is one of the things that we'll evaluate. We certainly evaluate what's going on with this. But right now, we still want to reiterate that while the services themselves, the weddings, the funerals, regular weekly worship, are covered under the new guidance that we put out with regard to how we're loosening up restrictions for May, the receptions, the funeral lunches, the gatherings before or after the service, those are not. We're still discouraging those. 10 people is the most because we are still working to slow the spread of virus here. We're going to take this a step at a time to make sure that, remember how I just talked about all that hospital data in Omaha and Lincoln and how it's stable? You know, we've got 49% of our hospital beds are available right now, 44% of our ICU beds, 79% of our ventilators. That's been actually, the percent ventilators actually been going up. That's been stable. We want to keep it that way, and so we're going to do this a step at a time to make sure that we don't endanger that healthcare system. We need to preserve it. So we'll certainly consider that feedback going forward, though. We appreciate that. Cody Ronfeld, WJAG, the residents of Elkhorn Logan Valley Public Health Department have expressed disappointment with the directed health measures being extended for the entire district. Who makes the final say in keeping whole district together when extending those measures? And are small businesses that most likely to have closed were they taken into consideration during this decision? So first of all, you may recall that when we rolled out these restrictions, we did it on educational service unit. We thought that it might be impacting schools the most. That got difficult because you started splitting up the public health districts. You might have the ESU and the public health districts didn't fully overline, so you had some counties that might be in an ESU but not in a different public health district, and that made it difficult to manage. So as we started rolling out the restrictions or loosening the restrictions, what we did is we kept it by public health district to be able to work with the local public health officials to be able to manage that. So that's why we're doing that. And again, ultimately, the state has the decision with regard to how those directed health measures are loosened up. And so we are working with local public health directors on their individual districts to be able to make those determinations. So this is a collaborative effort to be able to make sure we're accommodating what the needs are in each different public health district. So we want to continue to make that a collaborative effort. And again, it makes it easier by doing it with public health districts and those officials who are responsible for those counties. We understand that that's creating a hardship for some people. I mean, I've gotten a number of comments from people who are saying, hey, my county's not the one where the hotspot is. But again, we all got to remember that these counties are generally geographically close to each other. So there is some crossover. And again, we want to manage this in a way that is going to continue to preserve the healthcare system. So we are continuing to work with our public health officials. Please be patient with us as we work through this process. Tara Campbell from WOWT. We receive many calls from workers concerned about whether their place of employment is safe. Will you consider making it mandatory for companies/organizations to report to the state when a set percentage of their employees test positive for COVID-19? So to be clear on this, companies do not know when somebody tests positive for coronavirus unless that person tells the company. Okay, so this is a HIPAA law thing. It's a healthcare thing where the companies do not get to know this unless it is voluntarily disclosed by the person to be able to do that. And then, of course, the companies are free to disclose that if they wish, but we at the state, we've got a policy where we're not disclosing that on a company-by-company basis. We talked a little about this yesterday. We will do it in aggregate, such as we've done for long-term care facilities, but we're not going to disclose that, and employers don't really have a way to know. And in fact, one of the things we've run into is, as people have asked about this, is, we have, again, we the state, sometimes people give us bad information with regard to whether they worked someplace or not. So our information isn't exact either, and of course, we're just going to keep it to an aggregate then in that case, so that it lessens the problems with the data. So I would suggest, though, that if people, because the follow-on question here is, if not, how will workers know for certain their workplace is safe if companies are not required to disclose the information? Well, like I said, the companies can't disclose the information because they don't know it. Public health officials know it, but they are using it for public health official reason, like do the contact tracing. My suggestion is, if you are employed someplace and you are concerned about it, you should contact your employer. Ask them what steps that they are taking to do social distancing. And if you are doing social distancing in the workplace, again, 6 feet away, wearing a mask, don't share, lunch, bring your own lunch, that kind of stuff. If you're carpool only with people in your household, or if you're going to carpool with other people, only one other person, one in the front, one in the back, both wearing masks. I mean, these are the kind of steps you can take to make sure that you're doing that social distancing as you're traveling to and from work, as you're in the workplace. Your workplace is going to be safe. So do that social distancing, and you'll be fine. So I would say, if you got concerns, contact your employer and find out what steps they're taking. And with that, Taylor, do you have any questions that were texted in?
Don Walt wants to know if you've been in contact with packing plants in South Omaha to determine whether they have any outbreaks in their workforce.
So Don Walton of the Lincoln Journal-Star has asked, have I been in contact with any food processors or meat processors in South Omaha to see if they've got any outbreaks in their facilities? While I've not been on a specific phone call talking about that with those facilities about outbreaks, we do have a weekly call with all the food processors to be able to discuss best practices and so forth. And of course, Dr. Adipur, who's the Douglas County Public Health Director, also works in that community. And so we're continuing to monitor that situation, but I have not had specific calls with any of those food processors.
He also asked, with Lincoln Lancaster County's rate of new cases increasing, do you plan to extend the current DHM for Lancaster County?
So Don also asked, with the rate of new cases increasing, do we expect to extend the DHM beyond the May 10th? And, well, first of all, a couple things. Well, I just kind of covered why cases are not the key indicator here. Again, if you look at, just say, let's take Lincoln Lancaster, and you take out how many tests we've done versus how many cases we've tested positive, there's a strong correlation there. If you just overlay those two graphs, you'll kind of get the same shape of both. So again, as we test more, we will get more cases, and we are testing more. So that's the first thing. Second of all, we will also have DHMs for a while, folks, in some form or another. Now, am I planning on continuing the same restrictions that we've got in Lincoln Lancaster now past the 10th? I don't have any plans to do that right now. So again, we're looking to loosen up restrictions as we've seen the hospital system stay stable, and that's exactly what's happening in Lincoln Lancaster. As I mentioned, they've actually got fewer people in the hospitals today in Lincoln than they did last Wednesday.
Trent Luce wants to know what the scientific basis is for 6-foot social distancing and mask wearing.
So Trent Luce wants to know what the scientific basis is for 6-foot social distancing and wearing a mask. So coronavirus is a respiratory virus. That means that it is spread by people coughing and getting those droplets that have the virus in them spread out into the community. So they go out there, and there's been some question about how long they hang in the air or whatever, but generally if you are more than 6 feet away from somebody, even if they're coughing and spreading that virus, you are not going to get it because it just doesn't have that kind of range. Wearing the mask helps protect other people. So when you wear that mask, that helps protect other people so that when if you're coughing and you've got the virus, that's going to get caught in your mask and not have that 6-foot range. Coronavirus is a very contagious disease. It is not as contagious as, say, measles, but more so than things like flu. So that's why, again, when we're talking about these social distancing guidelines and the 6-foot rule, that's why we're talking about some of these things to be able to slow the spread of the virus.
Michael Shively with New Channel, Nebraska, says local public health departments vary widely in the amount of information they release. Would you like to see the way health departments share important data with the public change?
So Michael Shively asked, local public health departments vary with regard to the types of information they release. Would I like to see that more standardized? We work with local public health departments to get standard information that we would like to see at the state. So for example, one of the things that we've got to work on, some public health departments were collecting race, ethnicity, others were not. So we're asking all the public health departments to start collecting that because we, the state, want to have that overall view of the state. But we also want to allow public health departments to be responsive to their local community needs. So if there's things that they want to collect data on and give out, that's really kind of up to them to be able to do that, to be able to tailor what information they're giving to their local communities. So are there things the state asks for that we do want to get standardized information on? Other things, we let the local public health department make that decision.
Both Kristen Whitman with KPTM and Alexander Stone with KETV are asking about the PRAM model that UNMC has unveiled. They want to know if you think it's better than national models, and is it something that we can monitor to help the state reopen?
So Kristen Whitman and Alexander Stone, did I get that right? Both want to know about the PRAM model, which is so it's an acronym that UNMC came up with. Pandemic Recovery Acceleration Model. Oh, did I get that? That's pretty good. So do I think that's a better model than some of the national models? Well, the answer is yes, because it is specific to Nebraska. Whereas even if you look like at the IHME data, which is from Washington State University, that's projecting onto Nebraska, though based on a national model. It's not really tailored for Nebraska, and I don't know if anybody checks that thing out, but you often see the data is wrong or late, so it doesn't match up with what our data is here in Nebraska. But again, that's not terribly surprising because that's not actually meant specifically for us per se. It's a national model. So I think the advantage of the PRAM model is that it is tailored for us. I think the other thing it's just one of the ways that we look at the data. So that's just another important thing to talk about is that we've got a number of things we look at with regard to what's going on with the state, and the PRAM model that UNMC provides is one of those things that we look at. So it's part of the data set we look at. Again, the key thing I am focused on though is hospitalizations, because at the end of the day, that's what this is all about, is making sure we preserve our healthcare system.
Liliana Pearson says, with yard sale season coming, should people be having yard sales at all, especially if you don't know you're getting something from a household where someone may be sick?
So again, who was asking that question?
Liliana Pearson.
Liliana Pearson was asking, yard sale season's coming up, garage sale. Should people be having those? Again, I would say that is up to the person to decide if they have it. If they do, they need to follow the same social distancing guidelines that everybody else is doing, which means that you're not going to be able to have more than 10 people show up at your garage sale at any one time. 6 foot social distancing, you're going to have to spread things out, maybe all the way down the driveway or whatever. But all the steps that all those other businesses are taking, you're going to have to take those same steps too. So I would certainly suggest that if you're going to do something like that, you be thoughtful about it and make sure you're following those guidelines. And you're going to have to, for example, have probably stuff roped off. You're probably going to have extra people helping you to make sure people stay spread out that 6 foot distance, just like all of the other retail stores are doing. So caution, proceed with caution if you're going to go down that path. Maybe a better thing to do is if you really don't need to do that, you can push that off until after we get through this emergency.
Grant Schulte is asking if hospital capacity is the right metric to use. Would you be willing to add hospital admissions data to the HHS dashboard? It seems that would be a good leading indicator that ventilators, ICU beds may become strained before they actually fail.
So Grant Schulte says, hey, if you're looking at hospitals, should you add hospital admissions to the dashboard? And actually, we've been having conversations about how we adjust that dashboard, so we appreciate the feedback there, Grant. We'll take a look at that.
That's all I got for now.
Okay. Questions from inside the audience here? Yeah.
We had a viewer from Grand Island, let me find it, who got tested for COVID-19 last week and still hasn't gotten his results, and he wanted to ask you why the testing is taking so long.
So a viewer from Grand Island got tested for coronavirus last week, still hasn't heard back yet. I suspect that may be coming from one of the commercial labs, because typically at the Department of Public Health, we turn those around within 48 hours. However, some of the commercial labs have been taking as long as a week to get back to people. So I suspect that was the reason, but if that is not the case, if it was actually at one of our mobile testing sites, then Dr. Anton, what's the best way to kind of follow up on that? Because if that was our guard team or something like that, we probably should have that back faster, shouldn't we?
Just contact me.
Okay. Do me a favor. Well, Contact Dr. Antone, how are they gonna contact you?
Well,
There's probably a better way, right?
yeah, it would probably be through the public health department.
Contact your public health department. That's probably the better answer there, is contact your public health department, let them know, and they can run that down and find out what's taking so long to be able to get back on you.
Okay.
Yeah, Lee?
In regards to the releasing of the information, you don't want, you said you're gonna release it in an aggregate database. You release the nursing home data by location, by number of cases. Those are private entities as well. What's the differing factor between those and when you decide to not release the meatpacking plan?
So I don't believe the state has actually released, so the question was, hey, you've released nursing information on, I don't believe on a case-by-case basis. As far as the aggregate, we've talked about nursing homes we've had to step into to be able to move people, but I don't think we are talking about the specific number of people who've tested positive at specific individual facilities. I don't think we have, Dr. Antone. So we haven't done that at the state level. Now, public health, local public health might have, I can't say for certain on that, but at the state, we're only releasing that data with regard to the total number of cases testing positive, the number of deaths and so forth, and the total number of facilities on an aggregate basis. And actually, we're working on a dashboard just to do just that, so that we have a standard clarity on that. And so it'd be the same for fly for any other industry. Yeah, Fred.
There are demonstrators outside today that accuse you of allowing excess deaths by not keeping more things shut down, especially meatpacking plants. What's your response to that?
So the question was, we have demonstrators outside today that are saying we've got too many deaths in the state because we're not completely shut down. Again, especially in meat packing, meat processing plants. We had protesters last week saying we hadn't opened up enough. You get the fringes on both sides, Fred. I mean, you know, there isn't a single thing I do that isn't second guessed. So you got to look at the hospital data. That's what I've been focusing people on. We've been able to provide that hospital bed, that ICU bed, that ventilator to every single person. In cases, especially if you talk about the food processors, in Grand Island, we've worked with CHI St. Francis to be able to make sure that we're moving patients to create that space. In fact, today, if you look at CHI St. Francis, they actually, again, there's one of those hospitals where I think we got fewer people in the ICU, we got fewer people that are on ventilators today than we did a couple of weeks ago. So again, we got a very stable situation at CHI St. Francis. You look at the Lexington Community Hospital, same story. When we saw percent positive starting to go up there, we stepped in with more resources, testing, contact tracing. We, again, can do it. And again, if you go look at the number of deaths we've had here in our state specifically, they're mostly in those long-term care facilities which are not associated with the food processing directly, right? So, again, there are groups of people who are going to be vulnerable to this, and people should be aware of that. Right? If you are older, like 65 or older, and you have underlying healthcare conditions, you're more at risk. And so that's why as we do loosen these restrictions, if you're one of those high-risk groups, you ought to avoid some of the things we're talking about where you've got groups of people. So, but we've been successful in preserving our healthcare system, which was the goal that was set out for us, 2 months ago by public health experts.
We have a question from David Earl. Have you had conversations through this about the next project at UNMC? Is it more attractive now because of the preparedness Nebraska had going into this? And but is it possible to do this with revenues possibly being down?
So David Earl asked the next project, which was the building the hospital flex capacity for the Department of Defense at UNMC to be able to accommodate pandemics, or if there was some sort of nuclear exchange someplace in the world, or chemical, biological kind of things, anywhere where we had mass casualties someplace in the world and evacuating them back to the Americans, back to the United States and having a place for them. Is that process still on track? That is, again, a Defense Department program. Dr. Gold and I went to Washington, D.C. Actually, it's one of the last trips I took, or the last trip I took outside the state, to go visit the White House and talk about that program. So I expect that is still something that is in progress with the Department of Defense, and I think that this pandemic does highlight why such facilities are going to be useful, to the country to be able to help protect our national security. So I think that project still is one that's got merit to it, and what happens to it down the road will really depend on what happens with the funding, both at the Defense Department level and here at the state. So we'll still have to continue to work through that as we go forward, but I think it's still a project that merits our continued investment. Andrew.
Other states have been able to get around the HIPAA thing because they say they're not reporting specific people in a facility, but just, the amount of people in a particular facility. Why not for transparency and for, public safety, kind of require them to report those things when they have a certain amount, over a certain amount?
So the question was, why don't we, other states seem to somehow get around the HIPAA laws here, and so why doesn't the state of Nebraska try to get around it? Again, I think that, first of all, the employer doesn't know. Okay, the employer is not entitled to get around HIPAA laws. So unless the person who works for the employer specifically tells the employer that they've got coronavirus and gives them permission to release that, the employer can't do anything about it. So it's not like we can go to the employer and ask. Our experience has been, when we started collecting that from people directly, is that they didn't tell us the truth about where they worked. And so then we got bad information. And so what we're going to do is just stick to our plan with regard to, we will report aggregate data that we have. We're not going to report it on a company-by-company basis.
Would you recommend companies report that so that people know? I mean,
Well, then the following question is, do I recommend companies report it? Again, here's the deal. Companies can't get that data for sure, right? So for the same reason that we have trouble getting the data based on self-reporting, if somebody doesn't give you the right information, you're giving out bad data. So since you can't have good data on this, what we're going to do is do aggregate, and that will kind of give us a broad idea of what's going on, but we're not going to report on a specific facility basis. Paul?
So I got a couple different questions. One is about Test Nebraska. I talked to a doctor who works with COVID positive patients. She signed up for Test Nebraska. It said, you don't need to be tested. She was puzzled by that. She's the first, a medical worker on the front lines. Why wouldn't she be tested? Is she not in the top priority group, or what is it?
So the question was, there was a doctor who signed up for Test Nebraska. I presume that she said that she was a medical professional, but didn't get selected to do the testing. And I would say, one, we can certainly look into it. I'd suggest her again reach out to the public health department. We can follow up specifically with regard to Test Nebraska on that. Again, this is part of why we're doing a soft launch to kind of make sure we're working the bugs out of it here. I don't know why that person would have not been selected, but it could have been for any number of reasons. Was she in Omaha or Grand Island? Or in Omaha, again, we rolled it out to just a very limited number the first day, so she may get an email later on saying she's been selected to come in and for her to schedule an appointment, or maybe we got a glitch in the system somewhere that we got to work out. So but if she wants to contact directly, the public health department, we can start running that down to be able to figure out what's going on there about why she wouldn't be selected.
Is it just people that are symptomatic are being tested first? I mean, she did not
So
report
so our priority, the question was, is it just symptomatic people? So the priority is supposed to be healthcare workers and first responders, highly symptomatic people, less symptomatic people, and then as we have capacity to do the asymptomatic people. But right now, we're just focused on symptomatic people. So that may be one of the things that the algorithm focused on was the symptomatic people as we work through the first group.
So that she was asymptomatic would have knocked her out, you think? Because
Again, we'll have to go do the research and find out. It could just be we also have a glitch in the system as the reason she didn't get selected.
And the same doctor said she'd heard of people who are getting discouraged by their employers from taking the test because they say, well, if you take the test, you're going to have to sit out at home until you find out you're positive or negative.
So the doctor says she's heard from some employers are discouraging their people from taking the test. I think that's short-sighted for employers to do that, because if you've got somebody coming to the workplace with coronavirus who's symptomatic, they're going to give it to the rest of your workforce, and then you ultimately have the potential that all those people have to stay home if they get sick. So I think we would want to know that somebody either is testing positive or not. They may have flu-like symptoms and not have coronavirus, in which case then as soon as they've recovered from the symptoms, they can go back to work, versus if they've got coronavirus, then they do need to quarantine longer. So I think I would encourage employers to encourage people to take the test. That's going to be your best long-term strategy for making sure that your workforce is, quarantined appropriately when they need to be, and healthy and coming to work when you know they can.
I think she was concerned about people being discouraged from signing up because they don't have symptoms yet. But, they said, well, if you do get tested, then we're going to have to set you out until we find out you're positive or negative.
Oh, I'm sorry. So I missed the question. So the question was not so much if they get tested positive, just if they get tested at all.
Right.
There's a 48-hour period where the employer says, hey, you're going to have to stay home from work while we're doing it. And again, I would encourage employers, hey, do the right thing. If your people want to get signed up for testnebraska.com and you feel like you've got to make them wait at home, if they're symptomatic, they should be doing that anyway. Okay, if they're symptomatic, they should be doing that anyway. If they're asymptomatic, they're probably not getting prioritized right now to get testing anyway. But people can have the virus and be asymptomatic. So if somebody is not feeling symptomatic, but maybe has a reason to believe that might have been exposed to somebody, you should let them get tested so that you know, because you don't want them showing up at the workplace and infecting other people. So again, employers, do the right thing here. Let your people get tested. Encourage them to get tested. This is a good thing for Nebraska to slow the spread of the virus here in our state.
Just time for a couple last
Do you
questions.
know if anyone that was asymptomatic has been tested through Test Nebraska?
Do I know of anyone who has been asymptomatic that has been tested through Test Nebraska? I do know that I believe Teresa Anderson, who is the public health director in Grand Island, for that central district there, she signed up and she was selected to be tested. She's not symptomatic, but she had a high, obviously high risk of being exposed and that sort of thing. So I do know at least one person who didn't have symptoms, but because of her unique position was selected to be able to get the test.
Will it be possible to isolate?
And by the way, she said it went very smoothly too, by the way.
Who's
So-
heard?
Yeah, I asked her directly. I said, hey, I know you got selected. How'd it go? She said it went well. Dr. Poor also signed up but didn't get selected, but she said it went smoothly too.
Will it be possible to separate out the number of people tested and the positives according to Test Nebraska versus all the other kinds of tests?
Will it be possible to select out the number of people tested positive through Test Nebraska separate from everybody else? I presume it probably will be. I don't know that we've set the systems up to do that directly, but Dr. Antone, we can follow up on that and see how that goes.
Last question.
Last question. Yeah, Paul.
When we started this, the motto was flatten the curve. We don't hear much about flattening the curve these days. It's all about healthcare. Is flattening the curve just irrelevant now? Isn't that important anyway?
So the question Paul asks is, hey, when we started this, it was all about flattening the curve. Is that still important? And the answer is, we've flattened the curve, right? We have slowed down the spread of virus here in our state, and we have not endangered the healthcare system. The whole point of flattening the curve is to make sure that it didn't peak and overwhelm your healthcare system. So it wasn't flattening the curve for flattening the curve's sake.
Cases still keep rising though. People look at that and they go, well, that isn't flattened.
So Paul says cases still keep rising. But again, as we test more, we're going to find more people are getting tested positive. So again, that's why looking at cases really isn't a very good measure. So what you have to look at is what's happening to the hospital system, because that is something where whether people get tested or not, if they feel bad, they go to the hospital. And so that's really the measure we're focused on. So the whole point of flattening the curve was to make sure you didn't have that peak that overwhelmed the healthcare system. We've succeeded in doing that. Now we got to maintain that and start loosening up some of our restrictions, kind of my 5 miles an hour analogy I use, right? We've, in a sense, taken everything down to 5 miles an hour, and now we're trying to figure out what is the right speed to make sure we don't overwhelm that
Is
healthcare
that just
system.
something you've learned along the way that, maybe the focus needs to be on healthcare rather than
And the question was, is that just something I've learned along the way? No, that was what all the public health officials said 2 months ago, was the reason you flatten the curve is not to overwhelm the healthcare system. That's what everybody said 2 months ago. So that's the goals we originally laid out when we were doing this at the get-go, and that's what we've been focused on. Yeah, we focused on flattening the curve as kind of the way to communicate all the reasons we're doing this social distancing, why we have to stay 6 feet away from each other, why we're living in groups of 10 people or less, all those sorts of things. Why we're doing those things? Well, that is to flatten the curve, and we've done that. So we want to now continue to make sure we're preserving our healthcare system, because that's why flattening the curve was important. It's the whole reason we did it. Flatten the curve, don't overwhelm the healthcare system. We've done that. Now the key is, how do we start loosening these restrictions to be able to make sure that we don't overwhelm the healthcare system and allow people to start doing things, getting back more toward normal. Because at the end of the day, one of the other things that public health people said 2 months ago is that if you do it too early, people are going to get tired and stop paying attention to your social distancing. So what we've got to do is balance this to make sure that we're loosening up restrictions so that people don't wholesale just abandon our social distancing, and then when we need them to do it, they're not doing it, and that allows for the virus to come back. So again, it's been described as the hammer and the dance. You maybe have heard Dr. Lawler say that. You hammer down really hard at first to make sure you got it under control and you don't overwhelm the healthcare system. Now you do a dance to see how can you start loosening things up so that people continue to follow your rules and guidelines, but you don't let the virus back out again. And that's what we're doing right here now in Nebraska. Well, again, folks, thank you very much. I appreciate everybody taking time on their afternoons to talk about what the state is doing to slow the spread of coronavirus here in Nebraska. I want to thank all the Nebraskans for your patience, your sacrifice, everything you're doing to slow the spread here in Nebraska, to preserve our healthcare system and protect the most vulnerable people here in our state. And I especially want to thank the National Guard for all the great work they're doing to be able to assist on all these different missions that they have. Our men and women of the National Guard just make me so proud with all the great work they're doing. They really are serving their citizens here at home as well as what they do overseas. So thank you very much, General, to you and your team. And we will, again, see you all back here, 2 o'clock, Thursday and Friday, 5 p.m. Spanish briefing, all that in Central Time, 8:30 p.m. Central Time, NET, speaking of Nebraska.